Coming up in all angles, Jamaican nurses fighting COVID-19 in the hard-hit New York and New Jersey areas. They're working in testing.
3 or 4 persons would go to the person's home and conduct those tests. So we have home testing and drive-through.
In nursing homes.
Yesterday, she was telling me that, no one wants to come near me. They think I have something I'm going to give them.
In trauma centers.
Their oxygen level drops so fast that by the time you turn around to talk to them and you turn back to do your assessment, you're ending up intubating these patients.
And later on, an update on Shaun Townsend battling the disease in Italy. It's All Angles, and I'm Dion Jackson-Milo. And welcome to our viewers on onespotmedia.com. Now, Jamaican nurses are among the best in the world. And while many of us are safe at home, they're out there fighting COVID-19, many in the United States, which is being badly affected. We start our program with Claudette Powell. She's a past student of St. Hugh's High School. She lived in Malines Gardens, and she's now working in New York. Claudette, thank you so much for joining us. We appreciate it.
Thanks for having me. Good afternoon, everyone.
So,
yes,
you're a registered nurse, but you're not in the ICU. You're not in accident and emergency. You're not in casualty, as we used to call it. So, what do you do?
Well, as you know, nurses are found all areas in healthcare. And I have been in nursing administration for several years, and for the past 5 years as a nurse consultant. And with this crisis, all stripes have to be checked. I'm currently working on a special project with the New York State Department of Health, where I visit various sites, testing sites for COVID-19 in New York. So you have to remember, in order for you to treat people and to reduce the number of cases, you have to first do testing. So aside from the persons who are swabbing, who are the nurses, I'm one of those persons working alongside them to do other things, not working with the patients directly, but have to make sure that everything is working well.
Well, let me ask you first, give us your perspective on what's happening in New York, because we're seeing it on TV and it looks pretty intense.
Yes, it is. Today we had, the statistics here for today, we had about 1,200 deaths and about 66,000 persons tested positive. I personally think, maybe because I'm working in the testing area, that our numbers are coming up high because we're testing. And I have to commend the governor for that. All over New York State, upstate and downstate, testing centers can be found. So therefore, if you have those numbers, I think we're going to come up very high. Not hearing those numbers in other states don't necessarily mean that they're not there. Because as you know, with COVID-19, you can be asymptomatic. So the only way you're going to have the true number of persons with this disease is to be tested. However, on another note, it's unfortunate that not everyone can be tested because you'll be out of testing kits. So what they're doing right now is to test persons who are symptomatic. For example, in my area, if you have fever, cough, shortness of breath, you know that you have been exposed, you travel to one of those hot zones, you're going to be on the list. So persons don't just drive up someplace and ask to be tested. They are screened on the phone by professionals and given an appointment to go to one of the testing centers. We're truly hoping that one of these days we'll have several more kits that everyone can know their status, so that if, say, for God forbid, I should have it, I would know that I would have to stay away from others. Now I'm asymptomatic, it is assumed that I don't have the disease.
So how much pressure then is on these testing sites?
When you say how much pressure,
in terms of people turning up, people wanting to be tested?
oh yes, oh yes. Again, they get appointments, but every so often you'll have persons who just show up. In one particular day, 500 persons were screened. So it's several persons coming out. Fast. Most of the time, we range anywhere from 3 to 500, and these are done at drive-through centers. So persons drive up to the car. There are different steps, like 3 different stations for registration and so forth, before they actually get to the area where the swabbing is done. I also have to share that I was also involved in a project. You might have heard about we had the first big outbreak in Westchester County. Well, several persons who were exposed to that particular individual were quarantined at home. So, they were at high risk because they were right next to that person. So we had nurses going into homes. Now, most persons would never thought that could happen. But yes, the nurses were a team comprised of 3 or 4 persons, would go to the person's home and conduct those tests. So we have home testing and drive-through.
So you were part of the team that was doing the testing?
Yes, I did not go into the home, but again, I was part of the team working on that.
Okay, so what's the morale among the team?
Pardon me?
What's the morale? The morale for the people, how high is the morale for the team members?
Oh, I'm sorry, you mean as far as the workers?
Yes.
Or the persons who are being tested?
The workers.
As nurses, again, we are trained that, yes, we have feelings, but we have to really try to stay upbeat. It was amazing to see how we were ready to help. I did not see a sad face out there. Everyone had their personal protective equipment, and they felt comfortable that they needed to go out there and make sure everyone was being safe.
You mentioned that drive-through center or drive-through centers. That fascinates me. Tell me how that works.
You get into your car, you drive into this particular place was at a university on a huge field or parking lot. The car would enter, stop at station 1 to make sure they're on the list, stop at station 2 for another process, stop at station 3, maybe your form, we could not find your form, and someone has to complete it. And then the last step, station 4, you drive in your car, just like you're going to a drive-through, but all these steps that I mentioned to you, the persons cannot they have to keep their windows down because they got to protect the workers. So the entire time you're speaking with them with windows up. Then they go into the area for testing, and that's the only time that the window will go down because, as you know, they have to put it down and open their mouth. So those workers have even more protective gears than the ones that I would wear because I'm not in what I call the hot zone. And they drive off, and they would know that in maybe 48 hours, they're given a website. If they don't get a call, they can go on the website and get their results.
Okay, so is the drive-through process, is it done for speed and efficiency or to ensure distance between the healthcare workers, the testing team, and the people being tested?
I think both. Efficiency, because you imagine you can't get these people to go to a hospital to get a test. That's just, have a lot of persons there already. So this is one way of getting things done quickly and try not to put a burden on the hospitals.
And those were set up specifically for COVID-19, the drive-through centers?
Yeah, specifically everyone who drove through supposedly had symptoms.
Okay.
That's the only way they qualify. They have to meet certain criteria for that testing.
Okay, so when the results are ready now, what happens? If it is that a person tests positive, what does that then trigger?
They get a phone call, and it's usually done by a nurse because, again, we have to know how to speak with people with empathy because a lot of persons really will just not feel good to get a news like that. And I want to let people know as I'm speaking to you, it's not a death sentence. Most people don't die. The statistics show 81% of persons have mild symptoms. So not too often that although you might get a positive, it doesn't mean that you're going to die. But it's understood that we're seeing what's happening around us, that we are losing persons. So yes, the nurse would let the person know that their test is positive, and always you're going to follow up with your health practitioner. We know there's no cure, but if you become symptomatic, there would be symptom management.
Okay, so would the person then be referred, the nurse would then refer the patient to a hospital if needs be?
Well, if they don't have a physician, they would probably first speak with their physician on the phone, because not everybody has to be seen in a hospital. It depends on what's going on. So it's between you and your healthcare provider, because sometimes it has to become individualized. Your physician will know what your situation is. Maybe you're someone with asthma, so you have to get out to get a chest x-ray. I'm just giving an example. So it depends on the situation. Or you might be someone, they'll say that everybody's going to hear it right away, you have to quarantine. So although you're living in your house with other family members, you have to get away from them right now. You probably got them exposed already, but you still have to be quarantined for at least 14 days. So most people will not be venturing out unless they become very ill, start becoming short of breath, just can't breathe and have to get to the hospital. Unfortunately, some people will end up on the respirator.
Have you, in the time you've been working in this particular role, do you have any concerns for your own safety?
No, I don't think that I'm that much of a risk. And like any other healthcare provider, it's amazing. You just try to do your best. I wear the N95 mask. That's what was required of me, and the gloves, because I'm not working directly with those persons who are assumed to be infected. But also, one of the things with the other workers who are there, we are very stringent on the social distance. We do keep our 6 feet apart, and we all wear our gloves while on duty. And I'm going to emphasize that to your listeners. You have to try. We need to follow what the authorities are saying. Those are recommendations. Although it's a new disease, there's no cure, and some people feel much is not known. But I think we need to follow this hand washing, the social distance, and sanitize.
Still to come.
In the nursing home currently, it's pretty grave. Just in the last 24 hours, we've lost 8 patients, which is unusual for us.